Matt Town as part of McArthur Pet Month, which we as a staff have totally enjoyed because we're all pet owners and we really love our animals. So thank you so much, Matt, for agreeing to do this and being here at the library with us.
Yeah, you're very welcome. This is, I've been looking forward to this for the last month or so. So I appreciate it. I appreciate everybody coming out tonight to see all kinds of faces that I know from near and far. Some from early days of elementary school, some from vet school, some obviously all my family members, some clients now. So it's a lot of good stuff. So I appreciate it and the opportunity. It's gonna be fun. So we just sit back and get a chance to talk.
A couple of questions to sort of start out, and then we definitely will invite everybody to take some time at the end to offer, bring up questions of your own. If you have any comments or you have any technology issues, please feel free to mention it in the chat. We have our technology librarian on staff with us today, and she can help you out if you need any assistance. And share the screen right now.
So I guess I'll take this in the moment while we're waiting. I just want to thank the McArthur Library for putting this on. I'm looking forward to this. So this is a nice effort and a great way to reach out to the community. Melanie Taylor, the real driving force behind it. So I appreciate you taking the time to do that for us. Obviously my family, who some of them are here. I like to always have to give them some credit for some support. And then all of you that are here, because this is why we're able to do this tonight. So, and this has got kind of a great thing. Zoom, as bad as we all make it out to be, Zoom has allowed us to do things like this. So I'm seeing, again, friends from elementary school, friends from college, family members from all over the country. So Zoom is actually good for something. And I apologize for my background. I am not as tech savvy. I should have had my nice green screen. I could have worked something up, but all right.
So hopefully you all see the screen. I'm going to mute myself and I'll just be forwarding as we go along. But again, feel free to put comments in the chat if you have any issues seeing or hearing anything.
Sure. So we started off talking about a little bit about rewarding cases, and after, I guess a little bit back up and talk about myself a little bit. I'll try to keep it pretty quiet or pretty short. But again, I've been a veterinarian for 26 years almost now, and I grew up in Waldeboro, Maine, and a small dairy farm. And when I was in high school, I was still thinking about becoming a fighter pilot, engineer, something else like that. My brother really wanted to be the veterinarian. I was like, we'll go to Maine. Sure, we'll see what happens. And I'm glad I did not choose another career. It has been one of the most rewarding things in my life. And I've had a chance to meet great people, do a lot of good for my community, and have a lot of fun. I think that's the biggest thing about this is it's a lot of fun. So that's where I come from, and hopefully we'll try to give you show a little bit of what I do and how the fun I get to have. So when we talk about cases, I try to think. I was thinking back over the last 26 years of cases that I remember, and they kind of all blur to some degree, but there's ones that really stand out. And I can think about the first one was when my first year, actually first 2 months into practice at All Creatures in Rockport, Maine. And I was there covering the lunchtime, and we got a phone call that was hit by a car coming in. Like, okay, well, let's call the other doctor who was on lunch break. Maybe she should come in and give me a hand. And then somebody else walked to the door with a hit by car. I was like, okay, they're here already. No, that was a second hit by car. So here I am 2 months out of practice, second, getting 2 hit by cars within 20 minutes. From there, the biggest thing about that was they said, oh yeah, we can see his lung. Well, even for me, 1 year, 2 months out into practice, I was like, yeah, sure. Owners say that all the time. They're just it's gonna be a little bit of muscle hanging there. It's not lung. So we brought the dog into the room. Dog's sitting up, panting, looking at me, like wagging his tail, spaniel. And all of a sudden he took a deep breath, and out the side of his rib cage came lung. And I'm like, whoa, they are telling the truth. There is lung being exposed. So at that point it was, okay, what do? We stabilized. We got under anesthesia. We closed up the rib cage. We took all the air out of the chest cavity, so we didn't have the pneumothorax. Dog responded great, never looked back. But it was one of those, amazing cases when you first start out, and you just kind of roll into what you're supposed to do because there was no other choice. Again, growing up and starting practice in rural Maine, we weren't going to ship that dog to Portland or someplace else to have work being done at that point, 25 years ago. So we just, you just had no choice, but you jumped right in and did it. But I mean, that dog did great. And the fact, again, that whole thing, like even 2 months into practice, I already had the attitude like, oh yeah, sure. These guys, they're just the owners. Yeah, they're just seeing some muscle. There's no problem. Boom. And when I saw that, it was like, okay, they're telling the truth. I think we'll be okay. But it was kind of, and it worked out great. But there was just that thrill of seeing that, to be honest, and the fact that you could actually repair it and actually have a good result. So that was a really neat one from very early on in my career. I would say that another one that was this is probably something that again has changed over the last 25 years, but another one is a little dog named Lucky, who I remember very well, came in on emergency, very lethargic. I checked the counts of red blood cells and it was down in the low teens. It should normally be 25, 30 or higher. And it was basically an autoimmune disease. It was breaking down his red blood cells. And at that point, we didn't have any blood donors. I fortunately or unfortunately for the poor dog, although this other dog did well too, but a dog that had come in from the Humane Society had just had a leg amputation 2 days ago. And he was doing great, but he was still boarding with us. We're like, dude, you're the donor. So at that point, we didn't have even the normal blood collection bags. But I remember the ratio of like 9-to-1 with heparin. So I went ahead and drew about 50 mils of blood in a couple of big syringes, gave it very slowly over the next hour to Lucky, and he survived the night. And he went on to stay on some prednisone the rest of his life, to be honest, to keep his immune system from attacking his red blood cells, but never looked back, lived to be almost 16, and he was like 3 years old at that point. So that was another one that just like, hey, you got no choice. We're just going to wing it. And that wouldn't happen now today because that owner coming in, we probably would have sent to Portland to a referral specialist. But at the time, 25 years ago in the wild, wild west, it was like, hey, this is the best we're going to do. And I was fortunate enough to have the dog in the kennel, in the clinic already that I could use as a blood donor. He was a really big dog. There was no cross matching of blood types. It was like, oh, one time you're probably gonna be okay. Here we go. So that was, I still think back on that one very fondly. And I remember that little dog. I know his name and the owner's name still, 20 years later. One that really strikes me recently would have been a dog named Josie, who came in, I've been working with since she was a puppy, and came in and we took an x-ray, and she'd been lethargic and she was painful in the abdomen. When I took an x-ray and the spleen was very enlarged, and the owner was, of course, upset. And I talked to her about going to, again, another referral specialist to have exploratory surgery and ultrasound maybe being done. She's like, I'd really like to have you take care of her. So I scheduled her in for surgery as soon as possible, a couple days later, and did an exploratory surgery and found a mass on the spleen, removed the spleen, and you don't know what's going to happen at that point. And then to get back in just a couple days, actually just happened about a week ago. So to get back those results and find out that it was benign, so non-cancerous, just a large lymphoid growth of the spleen. So she's going to live a normal life. However, if I hadn't gone in, at some point that probably would have ruptured and she would have bled, to death slowly at home. So it was, I saved her life, and the owner had trusted me to do that. So when you have a chance to step back and really enjoy the job you do because you actually are getting that responsibility and people trust you, it's really it's empowering and really a great thing to do. So that was one that's been recent for me. Also, in my world, you always see me with dogs and cats now, but for 25 years I was a large animal doctor as well. So I got out on mainly dairy farms, a lot of sheep and alpaca farms. But I think working, the joy of being on a farm and doing a difficult calving and delivering a newborn calf that's alive that they could not deliver on their own. There's nothing after having grown up on a dairy farm, seeing that little live calf snort and blink and look at you and everything turn out well is still one of the most rewarding experiences that I can think of. And that happened, dozens of times over the last 25 years. but those still never got old. So those are always great. I've been sitting back as you get a little older, you get a chance to be a little more reflective. And sometimes I'm in just routine surgeries and routine cases, especially the routine surgeries. And you sit back and you go, somebody's entrusting me to take care of their dog right now. I'm just doing a spay surgery, and but this is still a major abdominal surgery that I'm doing. And so you're realizing not many people get to do this. This is pretty cool. And so I never have lost that feeling of the coolness of this job, the satisfaction of this job. And so that, I think that's a really big thing. Sometimes you just have to take that moment to step back just a little bit, take a breath, and kind of go, look what you're doing, and look what the difference you're making, and really enjoy it. And so sometimes just in this middle of surgery, I'll say, and I'll look at the technician and go, how much fun are we having? This is incredible. And they're like, okay, just shut up and finish the surgery. But you really have to take that moment to enjoy it. And I think that's a cool part. I think one of the last things is rewarding, and this is going to put a spin downer on it, but it's actually really important, is that I have probably almost 3 banker's boxes of letters and cards over the years. And, we get some of the letters for those great cases of the lung and, and lucky, but the ones we get the most cards for, there are euthanasias. That's where you make the most difference. You get to be this hero all the time. And, hey, they have the cape on. I just did this. But what they remember the most is what you do at the end. And that's a really important thing for us, and a really powerful statement of the difference we make in people's lives. And I think if we forget that as a profession, I think we're in trouble. But that's, to me, one of my most rewarding part is looking at those and understanding the difference I've made with all those patients and all those families, which is really cool. So that's just kind of going back over a little bit of 25 years. I can talk a lot more about other cases and stuff, but those ones really jumped out in my mind over the last 25 years and made a difference. Nutrition, a big question. This one always gets everybody amped up on this end. So there's the big discussion of brands, of homemade, raw, of everything else. So, I mean, this will probably come up maybe after we finish. Maybe some people will have some questions along this line. I think the best thing that you can do is starting off with a dog food that is AAFCO certified. So that means it meets all the basic standards. So that's step number 1. Then I think you need to then talk to your veterinarian about the ingredients and what is best for your dog or cat. I find a problem that happens a lot is that people tend to jump on the flavor of the month and the best marketing scheme. But what we really need to focus on is that we make sure that we're feeding appropriately for the age and the activity level of those dogs and cats. You'll see some foods that are for all stages of life. A Great Dane puppy or even an adult Great Dane, even more of a case, an adult Great Dane and a Chihuahua puppy are just different animals. They might be, still dogs, but they are 2 different animals that have different metabolisms, that have different problems and growth. And so you really need to look at, for puppies, matching up their stage of their size. So you have large breed and small breed. As we get into regular adult dogs and cats, starting to think about maybe what they do especially for dogs for activity. Are they hunting dogs? Are they sporting dogs? Do they need a higher level of protein, a higher level of energy? Are they dogs who are sitting around the house more? So maybe we need to watch that calorie intake so they don't become obese and have issues down the line. As they get to be seniors, we need to start thinking about maybe reducing that protein to take the protein away from them. We're not straining the kidneys as much, or other issues along those lines. So I think it's really important to talk to your veterinarian about the stage of life and the activity levels of your pets. One of the things I still think about too, and I'm okay with homemade diets. I just think that we need to make sure that they're balanced. And I encourage a lot of my clients who do feed homemade, that there are a couple different websites that you can find. like one that's called balanceit.com. I'll throw that out there just because it does give you really solid recipes for your pets that are well balanced and meet their nutritional needs of their age and activity levels. So I think that's really important. We get kind of thrown out like, hey, my friend told me about putting this coconut oil in and whatever. I was like, oh my gosh, did we actually talk to somebody who knows something about nutrition? So I think that's the part. Have that discussion with your veterinarian, and hopefully your veterinarian will give you some answers. And if not, they'll be able to maybe point you to somebody else who can help you on that end. So I think that's really, really important. Ticks. So they are busting out all over the place. I'm not sure some of the folks here, I know like Valerie's down south. And so she's probably seeing, I don't know what your exposure is down there, but I assume it's high. And then for us up here in New England, we are seeing our deer ticks going crazy, as well as our seeing a little bit of dog ticks, but mainly deer ticks. And the spread that I can see, I mean, for me, again, I reel it all back in. When I go back 25 years, I went to vets. I never saw a tick in Maine growing up. I never even thought about paying attention when I walked through the woods. Went to vet school at Auburn in Alabama and saw my first ticks. I'm like, well, that's nice. We learned a lot about tick-borne disease, which is great. But I thought, that's interesting. I'm never gonna have to worry about it. I'm going back to Maine. And it wasn't but a couple of years back into practice in Maine that I started seeing the first few ticks along coastal Maine. Then I moved and started practicing in central Maine, but along the Kennebec River Valley. And we started seeing a few. The first ones I started seeing were in Sydney and Vassalboro. I remember one family that, especially for people at that point, getting diagnosed for Lyme disease was really difficult. And their whole family had gone to Connecticut to go to a special clinic to get diagnosed. And they all had it, 2 children, husband and wife, and the 2 dogs. And so it's like, okay, this is real. And now we see ticks everywhere here. So they are definitely growing. The climate changes have definitely contributed to their exponential growth in our area. And so it is a true problem. I think we need to really be cognizant of it on 2 ends. We need to think about both as a pet problem, but also as a human problem, because our pets are going out, whether it's dogs and cats, are going out and going through the woods and getting ticks and bringing them back and potentially bringing them back to us as well. So taking care of the ticks on your pets will actually provide health and safety for you as well. So one of the things, there are a lot of good preventatives out there. We can look at some of the topicals, which you may look at, and some people like those a lot because they give a repellency. So if you're doing a lot of hiking and getting out in the woods a lot, you may want that for your dogs because you're going to try to repel those ticks before they even attach. Again, they don't tend to last as long, so you have to really be cognizant of reapplying and pay attention to how much water exposure, bathing, that kind of thing, because that reduces the effectiveness as we go along to the end of the month. So that we really need to stay up on that. The other one is our orals now, which do a great job. They actually do kill pretty nicely, but they require the tick to actually take a blood meal to be killed. So that whole discussion right there is like, wait a minute, I don't want a tick biting my dog. I don't want a tick biting my cat. And those are, very good points. And that's the discussion again with your veterinarian. What's the most important thing? A lot of people don't like a topical because it's messy. They don't like a topical because maybe they have young kids in the house. So that's another issue for them. So you have to kind of think a little bit of the whole, family, the whole area around the house and what their lifestyle is to move forward. But I think it's really in our area a no-brainer to make sure that we are covering our dogs and cats with a proper medication for fleas and ticks. I think also on our end is that we look at Lyme vaccination for our dogs. And that's made a tremendous difference to the amount of exposure that we see. It's not 100%. I mean, it's a bacterin, essentially, the spirochete. So those type of vaccines don't last as long. They're not as effective as our viral vaccines, but we're still, in the low 90s. And so that can make a huge difference to get them started at a young age and keep them on that vaccination for Lyme disease. Unfortunately, we have anaplasmosis, also carried by deer ticks. We have Ehrlichia, also carried by the dog tick. We have, and many others now. So, the Lyme vaccination only covers one thing. So it's kind of a belt and suspenders approach at this point. that you need to think about vaccination for your dog for Lyme disease if you're an endemic area, which we are. And then you need to think about a topical to help cut down on other exposure to more ticks carrying those other diseases. So I think it really is an important thing. And again, it's not just about our pets' health, which is very important, but it's also about your own health at this point. And I think veterinarians, we try to think about community health a little bit sometimes because it does make a difference. I'm gonna have to move my screen here. Let's see. There we go. My 14-year-old terrier has started snoring. Very good. Well, so I can directly relate to this. I had a old beagle who was the best dog, probably still my favorite dog. And because of her sinus passages becoming thickened with age, she would definitely make a lot of noise. So she actually slept in my walk-in closet just a few feet away from me, but it broke the noise a little bit. But typically with this 14-year-old, it's always good to go to your veterinarian. Make sure that you don't have any underlying disease going on. Is there any discharge from the nostril? So we have an infection or potentially worst case scenario, a tumor. Even potentially, I've seen a foreign body in the nose. I've seen dogs snort out sticks after a small piece of stick, a couple of weeks after going through the woods, or even longer sometimes. But generally, with that age, it's probably not going to indicate a major health problem. A lot of times it's just with age related, either sometimes obesity, just like in us, that it depends on their sleeping position and their larynx and their soft palate. But you also have to think about potential diseases. So getting a look back in the larynx, taking a look, making sure we don't have any discharge from the nostrils. That's really important. So most likely not, but it is something you want to start looking at. Can you tell us about llamas? So llamas and alpacas, this is one of those things, again, you kind of fall into. So at Auburn University, and the best, so I see a couple of us from Auburn, the best and oldest vet school in the South. And we had actually a donated herd of llamas for us. And they were actually llamas that were known as berserkers because they had imprinted on their humans at an early age and now were very difficult to handle. So it made for some wild times, lots of interesting times trying to draw blood, working on legs, getting kicked, getting spit on. It was kind of brutal, but when you passed that test, you kind of felt you could handle anything. So when I came back to Maine at that point, you had some early llamas. There was a woman in Rockland, Sharon Sampson, and there was another woman in Woolwich that had Lucy Harrington, who had alpacas. And nobody really not many veterinarians had any exposure to llamas and alpacas or any experience. And I got asked, hey, can you come out and take a look at them? I was like, sure, I've worked on these. I can come out and take a look. So again, you just don't know what you're doing. Sure, you always just say yes. And the first few times, I was able, so this is the kind of the funny part, is that if you can draw blood on an alpaca or a llama, which is sometimes difficult to do, if you can draw it well on them, the owners automatically thought that you passed the test. That's all you needed to do. It didn't matter any of your other knowledge. You could draw blood. You were amazing. So I was able to draw blood. So I slowly became the camelid expert in the mid-coast area. And then they actually have done quite a bit in Maine, working in a lot of herds. So it's been fun for me. The biggest thing, they're South American camelids. So they're part of the camel family. There's the llama, the guanaco, the vicuna, and the alpaca. So all four kind of cousins there. And they, the llamas are bigger. They are more pack animals, so decent fiber. The vicunas have this incredible fine fiber. They were kind of the animals of the Incan royalty. And then you have the guanaco, who is kind of the forgotten about one because it's not as big as the llama. It has poor fiber. It has a poor attitude. So nobody deals much with the guanacos. And then the alpacas, who I happen to work with a lot and have my own little small herd. It's something that I have fun with. It's provided me a chance to have a little release occasionally. And, you can go out there, like that picture kind of shows, you can go walk out there when they're eating their hay. If you just take the time to enjoy them and sit for a little while. They'll come up and check you out. So I really like, they're pretty much easy keepers. They're pretty much a really strong forage-based animal. So, if you provide them good hay and minerals and water, they do really well. Some need a little more supplementation if they're either older or they're pregnant or they're nursing, those kind of things. But they're just wonderful animals, really basically calm to work around. Nobody worries about being spit on, but they only do that when they either get scared or you really tick them off. So I love them. They're a lot of fun for me. And again, gives me that little chance to have a little, variation in my career. I don't have the time to really work hard as a farmer. I'd love to have a small dairy farm or all those kind of things, but it's just not going to happen. So the alpacas give me something else to focus on it, and it makes it easy. So that's why I enjoy them. They are a lot of fun. Questions from the audience? All right, we have all kinds of stuff going on already. Cool. All right. So I've got a chat. Let's see. Just going to read this real quick. Ooh. So I didn't have a chance to submit a question earlier. I have a 13-year-old dog and a 3-month-old puppy. The 13-year-old seems to want to play with the puppy, but the puppy is so full of energy and it turns off the older dog. Seems to want to play. That'd be great if it actually does. That's actually a good sign. So when can we expect the puppy to settle down a bit so they can enjoy each other? When we don't want the older dog to get aggressive to the puppy if the puppy gets on her nerves too much. So one would be a really good question is how old, what kind of puppy is that 3-month-old puppy? They often, so a lab. So everybody talks, when is this lab going to slow down? Like, yeah, about 5. So it's not going to slow down anytime soon. But I think one of the things I think about with my puppy and my older dog, I think about it just I'll back up for just a quick second. Sorry. But I often think of myself as a pediatrician, and because I'm dealing with animals who are babies who can't really talk. And I have my owners that I have to relate to and figure out what's going on. And this is a classic case of it. So the advice from a pediatrician is when you have an older child and you bring home the new baby, hey, it's a lot of co-play. So the older child doesn't get upset and jealous and feel like they're being kicked out and being forgotten about. So I think it's really important with our dogs to do the same thing. We really want to make sure that we make special time for that 13-year-old. We want to make sure we make special time for that 3-month-old. But we also want to get them both together and do similar play at the same time. So they understand that, hey, they are part of the pack, but they are still individuals and they're not forgotten. So I think that's really important. And the puppy is a Schnauzer mix. So and the older one is a Lhasa Apso. So it should be okay. The Schnauzers are really energetic and more of a little bit of a dominant dog potentially. But Lhasas have plenty of attitude too. So size-wise, we're going to be all right going forward. I think that's going to be good. I think so. This kind of co-play is really going to be important, and I think we'll actually work out pretty nicely. Sometimes we worry about the big dog, little dog, and somebody getting stepped on. Although I will tell you, with my 4 dogs, I have a 70-pound lab, a 60-pound lab mix, a 30-pound beagle, and I have a 4-pound Chihuahua. And the Chihuahua is the boss. So, and she moves fast, and everybody stays back from her. She's a wonderful little dog, but she just barks. She barks and they all back off. So it'll be interesting to see how this all works out. But I think if you do some of those things, making sure you have individual play, making sure you have the co-play and give it time, I think you'll be in good shape. And I have from Tony and Ben, I have, how do you deal with pets that become aggressive out of fear at the vet? Yeah, this is a great question. Our cat gets really violent, and I mean really violent. Yeah, and I've seen it. I've been on the receiving end a few times in my life, and so I'll plead guilty. We go back in time, and I still have them, but we have the big leather gauntlets. You walk in, and you pick up the cat, hold on tight, try to do the best you can, listening to the heart and lungs, and you kind of do a quick comb through, and then while they're hissing at you or trying to bite you, you look at the teeth and kind of go, okay, that's pretty good. and get your vaccinations on board or whatever else they're doing, and move on. Now, the thing about that is that doesn't help at all for the next visit. And I think we're really seeing that movement. And I think I'm really proud of the veterinary community to think about the fear-free movement, which is trying to get every dog and cat, every pet that comes, to not fear the veterinarian. If nothing else, at least low stress situations. And how do we do that? I think one thing is for the veterinary staff to really think about taking time, looking at ways to reward. I mean, I really enjoy taking a seat, sitting down, especially in fearful dogs. You take a seat next to their owner and just kind of put your hand out and just kind of talk to their owner, look away, don't make direct eye contact. Slowly they come to you. You try to give them lots of treats. Hopefully they're food motivated. If they're food motivated, it's a wonderful day. We get out tons of treats. We get out tons of spray cheese. Spray cheese is wonderful. Behold the power of cheese. It really is good. And so that's really where we try to take our time and give lots of rewards. I think the next part of it really comes down to talking to the owners up front about it. So we need to think about actually using, we call it, one is called a chill protocol. It's a little cocktail of several different medications. So you give those things at home before they even come in. Let's get them calmed down before they even walk in the door, so they're not amped up. We do those things. I've seen some dogs that are really quite fearful and quite aggressively and scary when they're fearful come in, and I've been able to do a full nose to tail exam, look in their mouth, do things. So if you take your time, think about when they're coming in. It's a process that needs to start even when they just make the appointment. To think about those steps. With cats, we can do the same thing of using some different medications to calm them down. I also really like the use of pheromones at the vet's office. So we started doing a couple different things. There's one called basically a feel away and spray, and that's a pheromone that helps relax. We also take our towels. We have a whole set of towels that are just used for the cats. They're not washed with anything else, so they are not having any other smells or odors from other pets. And we spray those down heavily with the pheromone. We keep them in a special little cabinet. I never got to it, but I think an even better idea to take that is then use a towel warmer, and you have these nice warm towels that smell, that the cats are just crazy excited for. You put them in that, and you have a whole different cat. So between taking your time, looking at some medications that can help take the edge off, and some of those can be some of our even nutraceuticals on that. And I everybody's thoughts here, but CBD is another one that is you see a lot of talk about it, but it has been effective as well, and this sometimes take the edge off. But those ones really help, and especially if we start planning for it ahead of time. And I try to look for small growth each time. I don't expect it to make a cat that has wanted to shred me one time and now is like purring and rolling around on my neck. I just want to be a little bit better. If that cat and that dog has a little better experience that time, the next time they come in, I do the same thing again. It's going to get better. And each time it's just step by step. And that's just like most things, right? If you're practicing, you're not going to be an expert the first time you go out and do any sport or go fly fishing or do whatever else you want to do. The same thing on this end. I don't expect that dog or cat to be awesome the first time after we've started addressing these things. So I just want those little incremental growth and growth step. So I think that's really, really good. So hopefully talk to your veterinarian about that, or find if they aren't really receptive. I support all my veterinarians. We are all in this together. We have a tough job. But if somebody isn't interested in talking to you about that, you might want to just push a little harder or look for somebody else that is willing to have the same personality as you. This from my very good friend, Valerie Orff. She has been a friend from Friendship Village since the age of 5. So there you go. At what age would you recommend neutering a puppy? So what kind of puppy? Golden for you, right? Yeah, I've seen the post. So I'm thinking about your golden. So really interesting stuff at this point. So there's been a lot of work on early spay and neuter, and even trying to find that right age. One of the things, so this is there probably haven't been enough studies. There have been some recommendations. I think for males of some of our larger breed dogs, you can probably still think about that 6 to 10 months of age. We start thinking about it, and some of the females even waiting a little bit, at least there's always used to talk about having a spay surgery before the first heat, but now there's some discussion about maybe even getting out to, again, that 10 months of age, even some dogs, even over a year of age. But then there's been some more recent studies just released that still go back to the normal old 4 to 6 month spay neuter times. And I see tons of dogs who come from shelters who have had early spay neuter that have been done at 8 to 12 weeks. And in my own hands, that is, I understand where they're coming from, but you do worry about running into bone and joint issues, especially in our large breed dogs. I think you might be able to get away with it in some of our small breeds, but our medium and large, especially large and giant breeds, it really becomes an issue. And I really think that, I think it's a really good discussion with your veterinarian. I think we all are seeing conflicting information, and we all have different ideas. I hopped on with kind of my old group of classmates just a couple months ago, and we talked about, just like, hey, what are you guys doing? And it was generally what I just said, but it wasn't across the board. It wasn't the same for everyone. So I think it really needs to be a discussion that you need to have. But I still think for most dogs, somewhere around that 6 months of age, our larger breeds, we might want to hold off, just again, get that proper bone and joint development. It also comes down to other factors. I mean, do you have a young female dog and you have an intact male in the house, or does the neighbor have the intact male, or something like that? So you don't want to have a pregnant dog that you weren't planning on being pregnant. So that is another, some of those factors you have to think about. And that's, we talk about the medical end, but then you have to think about the local end as well, because there are going to be some things that make your decision for you. I'm getting there. What's the weirdest thing a patient has eaten? Oh, wow. Darn. Let's see. So I wouldn't say the weird, I still have to go the weirdest. The poor dog just went nuts when it was home, had real anxiety issues. And so it came in, it had eaten the blinds, it had eaten plastic plants, it had eaten clothing, and it was all in one big ball in the stomach and starting down. And like, how do you get metal blinds? I mean, there's like the typical aluminum blinds. Like, how did you get that down? How'd you do that? So we started, just pulling stuff out and like, what is this? So those are actually some of those neat cases too. So I would have to go with that one. I haven't had the neat one of, I have had the bathrobe tie. That was pretty good too, because that was in the stomach, but it's already down the intestine. So you're slowly pulling it out. You have the snake coming back. So you're trying to tease it out. So that was pretty cool too. But those things you'll sometimes see. I never had one of the good ones. You'll see pictures of like a knife or something like that. Like I didn't have anything that cool. But the dog with the blind was like, oh my God, dude, how'd you do this? From my good friend Matt Robbins, why are you so much smarter and better looking than your brother? That was an excellent question. I would have to say, unfortunately, that my brother John, who is on this call, actually was much smarter than me, but I did beat him on the national board test. That was the final test, and so I will hold that over him. And better looking is in the eye of the beholder. I'm trying to be politic there, so maybe somebody thinks he's better looking. But thank you, Matt. I appreciate your consideration there. How do you get a puppy to stop biting? We call the devil child when she gets so wild. We are crate training excellent. And I'm going to scan up the crate training. We don't want her to dislike her crate when we put her in there to settle down, since her crate should be a safe place for her. Great questions. And I think that I love crate training on that end, because the bad part of it is that it's the name of it. I mean, if you had to go live in a crate, not real cool. If you had to go hang out in your den, that's pretty cool. And so dogs are den animals, and so they like to have a den. So let's make a den for them. So that is the crate. So I always like to make it very rewarding. I like to make it safe, whether you cover it with a blanket, sometimes even just to make it quiet. So that's really important to use that. But I think you're going to have great luck using that, especially in this kind of situation. I think when pups are biting, they get crazy, and they get going. You need to lift your hands up. You can tell them no. And if they need a little timeout, that's fine. Go ahead and put them in their crate. Put in their chew toys with them. Put in something that they are happy to be with. Don't just like, you're a bad dog, put them in. Like, hey, let's hop in your crate, and here's your Kong with your nice peanut butter and your cheese. And they're like, oh wow, hey, I'm getting a reward for going in my crate and being quiet. So that's what you want to just break down that energy level. And I think it comes down, I mean, you see my pictures. I love playing with puppies. Hey, it's fun, but you have to take a moment sometimes just to slow down a little bit and let them quiet down, pick your hands up, don't move around so much, don't make as much noise, let them calm down, and then really work hard with them early on about rewarding them for calm behavior. So when you start working early on, I mean, people think like their pups won't listen to them until they're 4 months of age. We really find that the formative time is probably between 6, definitely 8 weeks, up to 12, 16 weeks. If you miss it, wow, your job is much harder. So let's start off at early ages. Let's start working on them doing a sit stay. Let's start having them getting, rewarding for coming to you, getting a reward for being calm and doing those things. You can reward calm behavior, then you're going to be way ahead. So I think that's a huge part. So hopefully that helps. Try not to use the crate as a punishment. Make sure you make it a happy place. Make sure even they're going in after they've been kind of crazy, that they're getting a reward when they're in there. You may not want to give them the reward after they've been biting you. Just put them in there for a second, then come to them and give them that reward. And making sure they have their Kongs with frozen peanut butter, frozen cheese, and excellent. That'll make a puppy happy all day long. Some great stuff here if you look through the chat. So my dog ate a razor. They also found a gnawed piece of wood and 27 cents. So that's yeah. So they're pretty good on chewing that. They'll probably have to be right up there with me. So I have seen parts of a razor, like basically just a small bic. So that's good. And the coins. So that can actually sometimes be a problem there because we actually run into zinc toxicity. So taking X-ray, I've seen dogs with X-rays with lots of coins, and then we want to obviously actually sometimes have to go in surgically and remove them if they don't pass them. So John says it's all about the GPA. Well, we beg to differ. Advice on potty training. So I think we just hit it. So another good question from Valerie. So I think crate training is huge to it. And again, the dogs don't want to mess up their den, but you have to have the appropriately sized den for them. So if you have a 4x4 by 8 crate, and you get a little Chihuahua, the Chihuahua is going to go, yeah, this place is awesome. I can just go in this corner, it's fine. If you use the appropriately sized dens, then I think you're gonna have much better luck. And just using that when you're not around. So they go in there, they have their chew toy with them. It's a happy place. They have their bedding in there. As soon as you get home, as soon as you come back, hey, right out. And they go, usually first they're gonna go pee. Lots of praise, reward, come back inside. The biggest problem I tend to find is that a lot of pups think they've done a great job. They come back in, and then guess what? You look around and like, oh, and there's a pile to clean up. Because their attention span is about that long. And so they run out and they're all happy. They've been really doing the good thing for you, and they've gotten a reward. And then they come in like, oh, I forgot. So that's when you find it. So I tend, and also at any time after meals, that's going to stimulate the intestinal tract. So a lot of times I will find that folks, either when they come back in from going out and going pee, go ahead and take them back out short time afterwards, especially after they've gone out to eat, they've eaten, take them back out. Really comes down to frequency early on, just trying to get them out as much as possible, and then rewarding them for it. And then you can get into the really cool stuff of, having them ring the bell. Unfortunately, not me. I didn't work as hard on it. My dogs aren't as cool as some of yours. But ring the bell, doing all kinds of good stuff to let you know. I think that's I will find that is we talk about there is that we tend to focus on that they they've gone out and they've done their business, and then we think it's all good, and then we lose track of them. And like all of a sudden you look over the corner and they're like sniffing around. Oh yeah, great, he's back in. He's just sniffing around. He's being a pup, and you're like, oh, yep, he need to go. So if you start seeing some of that activity, yep, your better judgment, yep, you're probably right. They probably need to go. So worst case scenario is, yeah, you took your pup outside for 5 minutes. Probably not a bad thing, especially now the weather's nice. I think those are big things that really help. Being a lot of consistency is the big part of it. Terry Lambert with an interesting question on partial bloat. So I think this one will come down to dogs, which is really a big. So we have two things. We have a bloat, which is just a filling of air in the stomach. And that can happen as a result of some type of obstruction. It can happen as a result of a dog eating something that causes a lot of gas production. Or maybe they're really active, they're gulping in a bunch of air. But then we have the worst one, which is actually a true bloat, and what I would call a torsion, which is a GDV, or gastric dilatation and volvulus. So the stomach gets very large and then it flips. And when it flips, it twists. So now they can't get rid of gas. And so they continue to get larger and larger and larger. The biggest cases of those, you'll see a dog, actually, when I used to be covering all the emergencies for myself, so we talk about, yeah, he looks like he swallowed a basketball. And he's been trying to vomit for the last 2 hours and he can't. Like, yep, we know what's coming, because they have their huge stomach that's distended. So they're trying to vomit. They're trying to bring that up, but they can't because it's twisted. So that's a emergency surgical intervention. And so that's the full bloat. And when everybody kind of thinks, when everybody talks about bloat, I think that's what people are thinking of. But then you have just a basic bloat that is easily correctable without surgery. And that, again, caused by several different things. But I think that's what most people would think about. So that's what I have at that point. Come on, load me up. I'm on a roll. Ooh. So, and if people have some more questions, that'd be great. I think this is a timely subject for veterinarians, and you see all the happiness that I try to project with veterinary medicine. And for me, it has been, in general, a very happy time and a very rewarding profession. But unfortunately, veterinarians have a suicide rate that is 3 times the national average. And I'm sure all of you are thinking, how could that possibly be? Their job, that looks like the best job ever. And I think it really comes down to a few factors for us right now. Some of our young veterinarians, especially, it happens to all veterinarians, but I think our younger veterinarians have come through, and they have had, now their educational debt is very high. They're graduating, with $200,000, $300,000 in debt. And they are already having to go to work and worried about making payments and trying to pay that down over the next 20 years before they even try to buy a house, try to have a family. So those outside stresses. The next part is that, unfortunately, veterinary medicine is expensive sometimes. And when you do a good job for a client, and then the first thing you hear is, you're all in it for the money. That hurts and is real. It also comes down to the workload, and that's been hurt by COVID in the last couple of years, because we've been doing curbside many practices. That's changing slowly. So hopefully in the next 6 months, we will be much different. But it has reduced our direct contact with our clients. And I think all of us inside the building are feeling the pressure even more so. And as a result of that, there are a lot of people who are very anxious and depressed, and unfortunately committing suicide. And I think the biggest part of that is, as other veterinarians, we need to support each other and be open for them whenever they have a problem. And at the same time, I have tried to talk about it with a lot of clients in the few platforms that I have, to at least understand that it isn't always, rainbows and unicorns, that it can be pretty difficult. and that we are trying to do the best we can. And we're always trying to do our best effort. And sometimes things don't work out the way we want to. And that blowing up on a young veterinarian isn't really going to help anybody and may actually really hurt someone. For me, it's easy to talk about because I've been in this 26 years and I understand what's important in my life. I know my whys at this point in my life. But a lot of younger veterinarians, their why is their patient. Their why is their profession. That is their why. And so when they go to work and things don't work out well, they failed at their why. And that is incredibly crushing, especially when people then potentially pile on. So it's a huge problem in our profession. We're working very hard. There are a lot of different actually initiatives to work on that. But I think that'll be something we need to address, and we are, but that it'll continue to be a problem in a profession for the next, probably decade, but hopefully less, because it is, we really need to focus on each other and our mental health, and taking time to take a break and having some work-life balance is a very hard job. I think there's, we lose the fact when I started practice, work-life balance wasn't even discussed. And I think it's, working hard is still important, but we also have to realize what else is going on in the world. And we have to take time to make sure we find out some other whys. And I think that's really why I try to coach my young veterinarians, find your other whys in your life that you can focus on and blow off some steam. And that patient, that client isn't the choice. They aren't the deciding factor in your life and the deciding factor in how you want to live your life. So, but it is a really hard issue to talk about. Just understand that it is real, and that we, try to give your veterinarian a little benefit of a doubt, I guess, would be the biggest thing I would say. Oh, we have some. How about CBD oil for dog anxiety? So I have actually, I think, so I've started to do some work in this area. Hey, you live in Maine, you better at least know about it. I have used it for dogs for some additional control for seizures. I've used it for traveling. I've used it for joint pain and anxiety. Actually, I've seen some really good improvement. So there are a ton, I should know how many, but there are a number of cannabinoids in the process that are effective. And when you break those out, there's still a lot of work being done. But I think that's one of the things that, part of it is people come out and say, well, CBD for everything. Well, it's not probably for everything, but I've really seen great improvement, especially in the anxiety level, especially in the joint level for me. And I routinely at least bring up the discussion about it. I think you should at least bring up the discussion and let people then decide whether it works for them or they want to try it, but at least try to bring it up. So yeah, it looks like it did help Ed's anxiety. So I'm happy with that. Any tips on how to deal with resource guarding? My dog guards her food and the couch, not from people, only other animals. So that's a couple different factors in there on that end. One is like food guarding. So I had a little dog, Rosie, early on in practice. Awesome little dog. So the first time she came in, she was a happy little beagle, and then she bit me. I didn't see it coming. I misread all the signs. But we worked very hard on it, and she lived to be about 16, and she got to the point where she would run into the exam room, hop on the table, ride it up, roll over, let me trim her nails, do whatever. So it takes time, but it does work. So that's really, really kind of cool. But she was a horrible resource guarder. And one of the things that, and probably some of the other folks can chime in, and that's fine. But one of the things is, like with food, is feeding multiple bowls of food, because she always used to be a huge food guarder. Like, oh yeah, here's your little bowl of food. Oh, look, there's another bowl over here. Oh, look, there's another bowl over here. I'm going to go over to your food. Oh, you can't guard 4 bowls. So it just kind of short-circuited that response. It's like, okay, I give up. I won't do it. And another thing you can do on that is the hand feeding too. It's like getting them to learn, hey, I am your direct source for food. Please treat me with some respect. So I think that is one that works well. The couch is a little tougher because now it's her territory. So that is one that I tend to one of the biggest things is to try to work on that initially is having her stay off the couch, and then only allowing her to come on when you have either a situation, where you allow her to come on and she's with the other dog, and as soon as any kind of behavior changes, off the couch, you lose the privilege. So that was a little typical because one's territorial, one is food, but they're similar. I think again, you want to make them work for a reward and proper behavior. So I would work heavily on that. The food one's kind of easy one, kind of fun one. The couch is a little harder. So I know my dogs, unfortunately, do get on the couch, all of them. So do not do as I say, not as I do. But they also all get along pretty much on the couch. So if they're having an issue, start on the floor, allow them to then move to the couch under your control and under your guidance. And so I think that really helps. Sure. So one from Kim Scott. How do you veterinarians handle emotionally when you could save a pet's life, but the person can't? This is a part of. So I should read the rest of the question. Save a pet's life, but the person can't afford the necessary treatment. I imagine this contributes to the suicide rate of veterinarians. This must be very difficult. And that is a huge part of that, because we all want to save every pet. And at some point, the people, the clients, the family just can't afford to give the care that they need to give. I think in my role, I think this is why I try to coach young veterinarians, is that you always recommend the best treatment, but always try, and this is what I learned back at Auburn, because we had to deal with a lot of baling twine and duct tape to try to make things work sometimes. You had to think on your feet. But we try to give every other option that's available. So can you do something that's going to help that pet that may be less costly? It might not be the best, but it's something they can afford, and you will get acceptable results. Sometimes there are just devastating injuries that just cannot be fixed simply without a major intervention. And that is when you have to make that tough decision. And it does contribute to everybody's mood. Definitely upsets people. And I think it puts a lot of stress on, and we forget about all the staff. The technicians there are nurses that are in there. They deal with this just as much, and sometimes even more, because they don't even get a chance to necessarily talk to the client and work through it. They have to do what the veterinarian and the client and the family member has come up with. They're kind of they have to follow along what we've decided. And so that puts them in a spot of no real power at all, and no real say, and not being involved in discussion. So they are really affected by this kind of situation. So it is really hard. I really encourage folks to think about it when they're getting pets. I mean, you really have to think about that as well. Pets are a huge part of our lives and enrich our lives tremendously. But you really need to think about, can you afford, the proper pet care? And one thing that there is growth in insurance, pet insurance. Well, you may not need it to cover routine stuff, but let's get it for maybe the catastrophic care. So when something like this happens, you can afford a major surgery that may make the difference. And I had this discussion with a technician just the other day, so this is probably not good to talk about, but I'm concerned about veterinary medicine and the cost of veterinary medicine, and the growth of the cost of veterinary medicine. So we have to be able to pay for the things. We have great veterinarians, we have great staff, we have great equipment, we have a tremendous hospital that does things that human hospitals do, yet for a fraction of the cost, yet it's still expensive. And so we really need to be aware of that moving forward. And how do we make that work? I think it's a major discussion point for veterinary medicine in the next 10 years. And I think it's something that needs to be discussed. But it does definitely, to Kim's question, it can be very emotionally crushing when you, there are times that I have had to let a dog go, and you're looking in their eyes, and you know that you could do something, you know that you could help, but the family just can't afford it, and that's pretty harsh, and you have to understand that you've done the best that you can do, and that you gave that pet the best chance that you could, but sometimes you lose, and that's a hard thing for anybody to take, and it's harder for young veterinarians to take, and you really need to have a good support structure when those things happen. Who are the Pats drafting tonight? I am hoping for Fields from Ohio State. I hope we move up in the draft for a change. That's my hope. I think it starts at 8, so we got some time, but that's my guess. We'll see. I'll be able to have a beverage at that point and see what happens. Thank you, Helen. I'm glad you're here. So I have been having a good time, so I'm not even sure what time it is.
It's right around 7:30, so we're right on target.
Are we? Okay, very good.
Yes. If there's any other questions from anybody out there, please feel free to unmute and ask them now. If
Whoa,
not,
that's
we will
dangerous.
say thank you to Dr. T for joining us tonight. It was really terrific.
Thank you.
There's some more Patriots conversation going on too.
Yeah, you guys should check out the chat. So it's always good. I really appreciate you doing this, Melanie, and I appreciate the library doing this. This was a blast for me. Again, I've seen friends from elementary school and from high school and from college and vet school and current clients and my family, which is always a great thing. So it's just been a blast for me. I am always willing to do it again. And for anybody who has a question, you can hunt me down. I'm out there on whatever social media. You check out hashtag where is Dr. T. You'll find me. So I'd love to talk to you anytime.
Sharing all the wonderful pictures.
Yeah. So
I
I
love
I just hit on that a little quick. Like sometimes I see younger veterinarians and older veterinarians too, almost being resentful of clients wanting to talk to them. To me, that's the joy of it. So the fact that people want to talk to me, that they respect me and want me to take care of their pets and want to ask me questions, hey, bring it on. It's fun. So that's great stuff.
And thank you all for coming. We really appreciate it.
Thanks, everyone.
Good night.
Have a good night.